Welcome to the deep dive. You know, something we've all been doing since childhood is washing our hands. It seems so incredibly simple, right?
It really does. Just basic.
But after taking a plunge into the handbook downloadable.pdf, honestly, we've uncovered a surprisingly deep and fascinating world here. There's history, science, how this basic act really shapes our society.
It's amazing when you stop and think about it. Most of us just see hand washing as, routine, a chore maybe.
Totally.
But as we've explored the sources in this book, we've found this whole journey. It stretches from ancient traditions all the way to cutting edge research on the microbes living right on our skin.
Mm.
And it all points to this massive impact on keeping us healthy.
Absolutely. This book, it really throws a lot at you. You get how people cleaned themselves centuries ago, right up to the nitty-gritty details of germ spread in places like restaurants.
Yeah, and even what's crawling all over our money.
Right. So our mission today really is to dig through all of this and pull out the most important bits, the interesting stuff about keeping our hands clean.
Kind of a shortcut for you, the listener.
Exactly. Your shortcut to getting seriously informed without wading through everything yourself. Okay, so let's kick things off with the big question. Why is hand washing such a game changer for our health?
Well, the book hits this hard right from the start. The core reason, fundamentally, is its power to drastically cut down the risk of catching infectious diseases.
And spreading them too, I guess.
And spreading them, absolutely. We're talking about a simple habit that can potentially prevent millions of deaths and illnesses worldwide. It's almost hard to believe something so straightforward can have such a huge impact.
It really is mind-blowing when you put it like that. Millions.
The author even shares a bit about their own upbringing, didn't they? Being part of a really hygiene-conscious family.
Yeah, they did. There was that anecdote about using tissues, Kleenex, specifically to open doors in public places.
Wow, that's next level.
It really shows how ingrained it was for some families. But then the book shifts, gets more serious with the story of the author's mother.
Ah, yes, that was quite impactful. Who sadly got a fatal infection in the hospital after surgery. It's just a stark reminder of how easily infections can spread in healthcare settings.
Mm.
The term nosocomial infections comes up. Those are basically infections you pick up in the hospital.
Mm.
And the book mentions they affect, a significant number of patients, like 5 to 10%.
That statistic really makes you sit up, 5 to 10%. And it drives home that point about our hands being like little mobile germ taxis.
Exactly. They pick up germs from people, from surfaces, and then just pass them right along.
Mm-hmm.
It's this constant, invisible exchange happening all the time.
It makes sense. And you see industries responding, right? Like the food industry making changes.
Precisely. They've definitely made changes because of this understanding. Rules about jewelry, more glove use for people handling food. But the book also points out these aren't foolproof solutions.
Right. People have to actually follow the rules.
And even with gloves, if you don't really get how contamination works, touching raw meat, then touching a salad.
Yeah.
You can still cause problems.
That makes sense. And speaking of things we touch all the time, get this, our seemingly harmless paper money.
Oh yeah, the money thing.
Apparently it's a major hub for germs. The book mentions a study, I think it found something like 94% of dollar bills in one area had bacteria.
94%. And what was it, 7% had potentially harmful germs.
Yeah. I mean, does this mean we should be, washing our hands every single time we handle cash? Feels a bit extreme, but...
Well, that's the question the book kind of prompts you to consider, isn't it? Think about how many hands that single dollar bill has probably passed through. However, the book also brings in a crucial balance.
Yeah.
Our skin isn't just a blank slate for bad germs. We actually have a whole community of beneficial microbes living there.
Our resident flora.
Exactly, our resident flora. They help keep us healthy, and we definitely don't want to wipe them all out. There are actually concerns about overdoing it with things like antibacterial soaps.
Right, it's not about becoming sterile. And the book goes on to list other culprits, beyond doorknobs. Everyday things. Our phones.
Oh, phones are a big one.
Handbags, even just shaking someone's hand, they all play a role.
Which naturally leads us into this whole fascinating area of the microbiome.
Right. Explain that a bit more.
So, the book defines the microbiome as the entire population of microbes, bacteria, fungi, viruses, living in a specific place, like on our skin or in our gut.
Okay.
And studying these microbiomes is really key to figuring out which microbes are helpful, our resident flora, and which are the transient ones we need to worry about, the potential pathogens.
It's like this whole invisible ecosystem on us. The book even mentioned that study looking at belly button bacteria.
It did. which mainly just highlights how diverse our skin microbiome can be. Though, as the book notes, belly buttons aren't exactly major vectors for disease compared to our hands.
Fair enough. Not shaking belly buttons often.
Not generally, no. But a more relevant study the book discusses is called The Wildlife of Our Home.
Okay, what was that about?
It involved citizen scientists, basically everyday people, helping study the bacteria in their own homes. And it showed this fascinating concept of our personal cloud of microbes.
A personal cloud.
Yeah. This unique microbial signature that each of us carries around. We shed microbes constantly, leaving this trail behind us wherever we go.
It's incredible. So we're basically walking microbial emitters.
Pretty much. And it doesn't stop there. The book dives into the microbiome of offices, too. Looking at desks, chairs, phones.
What did they find? Anything surprising?
Well, one interesting, maybe slightly controversial finding was that offices primarily occupied by men tended to have more contamination than those predominantly occupied by women.
Really? Any idea why?
The book doesn't give a definitive reason. Could be lots of factors, but it's definitely a surprising detail they included.
Okay. And then there was the subway study. That got some press, I remember.
It did. That study on the subway microbiome initially made headlines for finding DNA matching potentially harmful microbes like plague and anthrax.
Oh.
Yeah, scary stuff. But the book is careful to explain a really important correction that came later. There's a huge difference between finding fragments of a microbe's DNA
and finding an actual live germ that can make you sick.
Exactly. That distinction is crucial. Just finding DNA doesn't mean there's an active threat.
That's a relief. But the subway study did uncover something else interesting, didn't it? About human DNA.
It did. They found lots of human DNA in subway stations, and it raised the possibility of using that data to learn about the ancestry of the people using the subway system.
Fascinating. Shows how studying these environments can lead to unexpected places.
Absolutely. And the book really emphasizes just how complex and dynamic these microbial communities are. Even in a hospital room, which you'd think would be pretty stable.
You'd hope so.
The microbiome can actually shift quite significantly in just a matter of hours.
Wow. Which makes you wonder about cleaning effectiveness long term. And what about after we wash our hands? Do the microbes just disappear?
Well, not entirely, and they come back surprisingly fast. There was a study mentioned where they had people wash their hands in a controlled way.
Okay.
They still found differences between men's and women's hand microbiomes afterward, and our hands get recolonized by bacteria pretty quickly. Within hours, really.
So washing is important, but it's not like a permanent fix. The bugs come back.
That's right. It suggests it's not just about washing, but maybe how often, the technique used. It's complex.
And people's habits vary wildly, right? The book had some data on that.
It did. Some observational studies, like one in airport bathrooms. Toronto seemed to have the highest rate of hand washing after using the toilet.
And who is lower?
Miami and Chicago were mentioned as having lower rates in that particular study.
Interesting. And college students, how do they fare?
Not great, according to the data presented. Women were more likely than men to wash after using the toilet, which perhaps isn't surprising based on other studies.
But the real shocker
was how few students of either gender reported washing their hands before eating. That hand-to-mouth route for germs is clearly still a major blind spot for many.
Yikes. Okay, so we know why we should wash, and we have an idea of what's living on our hands. Let's get into the actual science. How does washing work? And what about drying?
Right, the mechanics. This is where the concept of log reduction comes in. It sounds technical, but it's pretty straightforward.
Lay it on us.
So when scientists talk about reducing bacteria, a 1.0 log reduction means you've killed 90% of them. 10% are left.
Okay, 90%. Seems pretty good.
It is. A 2.0 log reduction means you've killed 99%, leaving just 1%. A 3.0 log is 99.9%, and so on.
Got it. So how effective is typical hand washing then?
Well, here's the eye-opener. A study found that typical hand washing, just the way most people do it without specific instructions or timing.
Like a quick rinse and shake.
Pretty much. It often achieved less than a 1.0 log reduction.
Less than 90%? Wow. Okay, that really makes you rethink that quick rinse, doesn't it?
It certainly does. But the good news is, when hand washing is emphasized and done properly, it works. Studies in schools show fewer kids missing days.
Makes sense.
And using alcohol-based hand gels at home can significantly cut down on respiratory illnesses. The book points out that our homes are actually major sites for germ transmission because of all the close contact.
That's a key point. We think of public places, but home is crucial too.
And related to that, the book highlights a surprising gap in parental knowledge. Only about 2/3 of parents surveyed believed colds spread through direct contact.
Really? How else would they think it spreads?
Good question. It suggests there's still a need for basic hygiene education.
Clearly. And for people working in places like childcare centers, the book gets specific, right?
Very specific. It lists all the crucial times for hand washing. After bathroom use, helping a child use the toilet, changing diapers, handling pets, playing outside, before handling food, after touching bodily fluids. The list is long, but essential.
There's even a golden rule.
Yeah, the golden rule of hygiene. Basically, use running water and soap at the right times, dry properly, and if you're ever in doubt, just wash your hands.
Good advice. Now, what about drying? That seems simple, but apparently there's a whole debate there, too.
There really is. Paper towels versus electric dryers. The book dives into this, presenting a study that compared 3 main methods. Regular paper towels, those warm air dryers,
The ones that take forever.
and those really powerful jet dryers that blast your hands.
Okay, so what's the verdict from that study?
It sounds like paper towels came out on top. They seem to be the most effective way to both dry your hands and reduce the number of microbes left.
Why is that?
It seems the physical friction of rubbing your hands with the towel actually helps remove bacteria, in addition to just absorbing water.
Interesting. So it's not just about being dry, it's the rubbing action.
That seems to be a key factor.
Yeah.
Now, the book does responsibly point out that this particular study was funded by the European Tissue Paper Industry Association.
Ah, okay. Good to know. A potential bias.
Potentially, yes. It's always important to consider funding sources. However, the book also notes that the study's methodology seemed sound, scientifically speaking.
Fair enough. But what about the air dryers? Are they bad?
Well, the concern raised, and supported by some experiments mentioned, is that both warm air and jet air dryers can actually spread microbes around. They blow air, right?
Yeah. Oh no. Blowing germs everywhere.
That's the worry. The book mentions an experiment using harmless yeast spores to simulate how these dryers can disperse microbes into the air and onto surrounding surfaces.
Yikes. So even if they dry your hands, they might be contaminating the rest of the bathroom.
That's the potential issue highlighted. So even taking potential funding bias into account, multiple studies seem to lean towards paper towels being more effective overall at reducing bacterial counts on hands after washing.
Okay, paper towels it is then. Good to know. So we've covered the microbes, the science of washing and drying. But this whole idea of hand hygiene isn't purely modern, is it? Let's look back at the history.
That's right. It's fascinating. The book explains that while we think of hand washing primarily for health and stopping disease, its earliest origins were often tied to religious practices.
Focused more on purity.
Exactly. Ritual purity, spiritual cleanliness.
Yeah.
It wasn't necessarily about germs as we understand them today because, well, they didn't know about germs.
Makes sense. Can you give some examples?
Sure. In Judaism, there's a long tradition of ritual hand washing, netilat yadayim, with specific guidelines and texts like the Talmud for washing before eating bread or after using the restroom.
Okay.
Islam places a strong emphasis on wudu, the ritual washing before prayer, which includes hands, face, arms, and feet. You see dedicated washing facilities in mosques.
Uh-huh.
The Baha'i faith also includes washing hands and face before obligatory prayers as an important practice.
What's really striking is that even these ritual washings, sometimes just with water, seem to have had a health benefit, right?
Yes. The book notes that studies in some cultures show that even washing with just plain water was associated with lower rates of diarrheal diseases. This led to this idea of a hand washing ladder. Water alone is good, the first rung. Adding soap is even better, the next rung up.
So even without soap, just the act of rinsing helps?
It seems so. A British study mentioned confirmed that just using water can significantly reduce fecal bacteria on hands. So these ancient practices likely had unintended public health benefits.
But it wasn't always an upward trend, was it? The book mentions a decline.
Right, hygiene practices reportedly declined in parts of Europe during the Middle Ages, especially after the fall of the Roman Empire, which had actually developed pretty sophisticated sanitation systems for its time.
A bit of a historical step back, but then things started to change with the scientific revolution.
Exactly. We get these key figures who started peering into the unseen world, like Antony van Leeuwenhoek in the 17th century.
The microscope guy.
The microscope guy. He was the first to see these tiny animalcules, or beasties, as he called them. He even discovered that hot coffee could kill them.
Huh. Early antimicrobial research.
You could say that. And then Lazzaro Spallanzani later challenged the idea of spontaneous generation, arguing that microbes came from other microbes, not just appearing out of nowhere. Crucial steps.
But the real bombshell for hand hygiene in medicine came later, didn't it? With Semmelweis.
Ignaz Semmelweis, a tragic but pivotal figure. Working in Vienna in the 1840s, he made the connection between doctors performing autopsies
And then going straight to the maternity ward.
without washing their hands and the incredibly high rates of deadly childbed fever or puerperal sepsis.
And what happened when he made them wash?
He instituted a policy of hand washing with a chlorine solution between autopsies and patient contact, and the mortality rate plummeted dramatically.
Just like that.
It was stark evidence. But tragically, his ideas were largely rejected by the established medical community at the time. It took years for them to be accepted.
Unbelievable. But his work paved the way. Who came next?
Well, Louis Pasteur's work in the mid to late 19th century was fundamental. His discoveries about fermentation, proving that microbes caused it, led to pasteurization.
Right, for milk and wine.
And critically, his development of the germ theory of disease, proving that specific microbes cause specific illnesses. That changed everything.
And then Lister picked up on that.
Joseph Lister, exactly. Building directly on Pasteur's germ theory, Lister pioneered antiseptic surgery. He started using carbolic acid to sterilize instruments and clean wounds.
And that made surgery much safer.
Hugely safer. It drastically reduced post-operative infections. And then you have Robert Koch, who developed rigorous methods, cost postulates, to definitively link a specific microbe to a specific disease, identifying the culprits.
So Semmelweis, Pasteur, Lister, Koch, these are the giants.
Absolutely. The book sums it up nicely with a list of most important hygiene developments. Ritual washing, understanding contagion, Semmelweis's insight, antiseptic surgery, germ theory, vaccination, identifying different types of pathogens.
It's quite a list.
And the impact is undeniable. The book notes the dramatic increase in life expectancy, particularly over the last century or so, largely thanks to these medical and public health advances.
It really puts our modern focus on hygiene into perspective. Okay, so we know the history, the science. Let's turn to healthcare today. You'd assume hospitals would be models of perfect hand hygiene, right?
You would hope so. It's certainly the goal. But the book reveals, well, some concerning realities. It starts with the concept of standard of care.
Meaning what, exactly?
It's basically the level of care that a reasonably prudent healthcare provider would exercise under the same or similar circumstances. Falling below that standard can lead to negligence claims.
And it all comes back to first do no harm, right? Primum non nocere.
Exactly. That principle from the Hippocratic Oath is fundamental. When the skin barrier is breached, like in surgery, preventing contamination is paramount.
The book mentions surgeons scrubbing for 10 minutes historically.
Yes, that was a common benchmark. Practices vary now, sometimes shorter scrubs combined with alcohol rubs, but the goal remains minimizing the microbial load on the hands. Interestingly, for minor procedures like in dermatology, alcohol rubs are often preferred now over traditional soap and water scrubs.
And does good hygiene in hospitals actually make a measurable difference?
Oh, absolutely. The book highlights a powerful study from a neonatal ICU. They implemented a standardized hand hygiene program.
For those tiny, vulnerable, premature babies.
Exactly. And they saw a significant reduction in nosocomial infections among those infants. Direct proof that it saves lives.
That's fantastic. But then there's the flip side, the compliance issues.
Yes. The book presents some sobering data. A survey in one Tennessee hospital showed surprisingly low overall hand hygiene adherence among healthcare workers.
How low?
Worryingly low in some areas. And there was a stark difference between the adult ICU and the pediatric ICU, with much lower compliance in the adult unit. Almost half the time hands weren't being cleaned when they should have been.
Why the difference? Does the book speculate?
It suggests potential factors like staff attitudes, maybe differences in training, education, or perhaps closer supervision of the pediatric setting. But it's a concerning gap.
And it's not just if they wash, but how and when. Right. There were knowledge gaps, too.
Yes. That same survey found misconceptions, like healthcare workers thinking alcohol rubs were okay even if hands were visibly soiled or dirty.
Which isn't the case.
No. Alcohol rubs are great germ killers, but you need soap and water to physically remove dirt, grime, and certain types of germs like C. difficile spores.
And the book mentions something about doctors versus nurses.
It did note that several studies suggest doctors, on average, tend to have poorer hand washing records than nurses.
That seems counterintuitive. Why might that be?
The book doesn't offer a definitive answer, but speculates on factors like perceived time pressure, maybe moving between patients more quickly, perhaps even attitudes. But it's a recurring finding.
So what can be done? How do hospitals try to improve this?
Well, pragmatic approaches help. Making it easy is key: convenient sinks, plenty of easily accessible hand rub dispensers. Education and reminders are also crucial.
Just making it impossible to ignore.
Pretty much. And the principle of when in doubt, throw it out for potentially contaminated materials is vital. The book uses single-use catheters as an example. Reusing them carries huge risks.
But even knowing all this, compliance remains a challenge.
It does. It's a persistent problem. The book discusses a study comparing 2 hospital campuses. It found differences in compliance linked to facilities, but also staff attitudes. Compliance also varied across different medical specialties.
Did anything seem to work in that study?
Interestingly, nurses' compliance improved temporarily right after a visit from the Joint Commission, the accrediting body. Sort of a being watched effect.
But it didn't last. And what about doctors?
It didn't seem to create sustained change. And the doctor's behavior didn't shift much even then. It suggests that external pressure alone isn't enough.
So just putting out hand sanitizer isn't the answer?
Likely not, without a broader program focused on behavioral change, education, feedback, making it part of the culture. And accurate measurement is key. Self-reporting is notoriously unreliable compared to direct observation.
People say they do it more than they actually do.
Almost always.
Yeah.
The book quotes some pretty strong opinions from medical professionals, emphasizing just how critical hand washing is, calling non-compliance unacceptable, even questioning the arrogance that might prevent it.
Strong words. What about empowering patients?
Yes, initiatives like the Ask Me If I Wash My Hands campaign aim to do that. The book offers practical advice for patients. Feel empowered to remind staff, ask your visitors to wash, be aware of sterile procedures, have an advocate with you if possible.
And it mentioned the WHO's 5 moments.
Yes, the World Health Organization's My 5 Moments for Hand Hygiene. It's a clear framework for healthcare workers. 1, before touching a patient. 2, before a clean aseptic procedure. 3, after body fluid exposure risk. 4, after touching a patient. 5, after touching patient surroundings.
Simple, clear reminders.
If followed consistently, they make a huge difference.
Okay, so healthcare is critical but complex. Let's broaden out again. What about everyday objects and surfaces? The touch at your own risk section.
Right. Back to those foams that Fracastoro recognized centuries ago, contaminated objects spreading disease. The book even shares a chilling historical anecdote about a green stain of death on a woman's hands from touching contaminated linen during childbirth.
Reminder, what about more mundane risks, like the 5-second rule? Is that real?
No. The book firmly debunks it. Food can pick up bacteria pretty much instantly upon contact with a contaminated surface.
Especially wet food.
Especially wet food, yes. And the type of surface matters, too. A study mentioned used apples and Skittles dropped on different surfaces to demonstrate this. So, sadly, no 5-second grace period.
Okay, myth busted. What else harbors germs unexpectedly? Fabrics?
Fabrics are a big one. Neckties, for example. Studies show bacteria can survive on silk and polyester for quite some time. Fabrics pick up microbes throughout their life cycle, manufacturing, handling, wearing.
Can you even disinfect them properly?
It's tricky. The book mentions experiments testing different methods. Steam ironing worked better than dry heat for some bacteria, but even dry cleaning didn't always eliminate everything.
Wow. Okay, what about gloves again? Outside of healthcare, like food service.
Same principle applies. Gloves are not a substitute for hand washing. They can get contaminated just like hands.
And they can get holes.
Exactly. Even high-quality surgical gloves aren't impermeable. Studies show a significant percentage develop microperforations during use that might not be noticed.
So the barrier isn't perfect?
Not always. And remember the money contamination. That bacteria can transfer to the gloves of a food handler who might then touch ready-to-eat food.
Yeah. The book had some gross stories about money handling. And that tracking website, Where's George, kind of makes you think about the journey of cash.
Really does. And different types of currency might hold on to bacteria differently. That study found higher counts on the Romanian leu, which is more plastic-like.
Interesting. What about things we wear? Rings.
Rings are definitely an issue highlighted, especially for healthcare workers. Studies found more bacteria on nurses' hands when they wore rings, even after using alcohol hand rub.
So the ring protects the germs underneath.
It seems to provide a refuge. This has led many hospitals to restrict ring wearing. Wristwatches and even dangling equipment like ID badges or stethoscopes can also pick up and carry pathogens, including things like MRSA.
Stethoscopes too, the symbol of the doctor.
Yep. The book mentions MRSA being found on stethoscopes after examining just one colonized patient. The velveteen rabbit analogy was used, loved, and shared, but potentially carrying germs.
Then our phones.
Our phones, our constant companions. A review of multiple studies found high rates of contamination on mobile devices in healthcare settings.
Especially smartphones.
Especially smartphones, yes, compared to older, simpler phones. They tend to have more bacteria, including potentially harmful ones.
So what should we do? Clean them constantly.
The book suggests regular cleaning, maybe with a slightly damp microfiber cloth or specialized electronic cleaning wipes. It advises caution with homemade alcohol solutions, as they might damage screens or coatings.
Good tip. Okay, move into the kitchen. Food safety at home.
Crucial area. The book reiterates the basics. Proper handling of raw meat and poultry, keeping it separate from ready-to-eat foods like salads, using separate cutting boards, and cooking foods to safe internal temperatures to kill pathogens.
Standard advice, but always worth repeating. What about travel hygiene?
Important considerations there, too. Hygiene standards can vary a lot internationally. Cultural norms differ, like handshaking frequency. The book advises researching your destination, checking hygiene rankings if available.
And we encounter different microbes when we travel.
Exactly. We each have our unique home microbiome. When we travel, we encounter different environmental microbes, different people's microbes. This can make travelers more vulnerable, especially in areas with diseases they haven't been exposed to before. Think historically, the devastating impact of new diseases on populations.
So research risks and take precautions. What about hotels and planes? Any tips?
Yes, practical tips like choosing reputable places, reading reviews focusing on cleanliness, being aware of high-touch surfaces, remote controls, light switches, pillows, airplane tray tables.
Use antibacterial wipes on those.
Good idea. Also, washing hotel room glasses yourself, wearing flip-flops in showers, maybe checking sheets, even bringing your own pillowcase if you're particularly concerned, and sticking to bottled water if the local supply is questionable.
Lots to think about. Okay, we've covered the problems, the risks. Let's end on solutions. How can we actually improve things and protect ourselves in society?
Well, the book suggests that increased awareness itself might already be changing behavior somewhat. People are just more conscious of germs now, perhaps.
And medicine is evolving based on evidence.
Definitely. The shift towards accepting alcohol-based rubs for surgical scrubbing, based on effectiveness data, is a good example of evidence-based practice taking hold.
What about bolder ideas, like banning handshakes in hospitals?
That's discussed as a possibility, a way to reduce a very direct route of pathogen transfer. The book mentions a study on bacterial transfer during graduation handshakes.
But it had limitations.
Right. It involved healthy people, only looked at bacteria. So it's suggestive, but maybe not definitive proof for a hospital setting. Still, it raises the question.
And the book tackles some common myths.
Yes, important ones, like if it looks clean, it is clean. Definitely false. Microbes are invisible. Or if someone washed their hands, they are clean. False. Depends how well and when.
And the idea that non-compliant people are just lazy.
The book argues that's usually false too. Perfect compliance is incredibly hard. Systemic factors, workload, facility design all play a huge role. It's not just individual carelessness, usually.
So what strategies do work to improve behavior?
A multi-pronged approach seems best. Education is key. Even simple things like the happy birthday song timing technique. Reminders, help posters, automated prompts near sinks, observation and providing feedback to staff. And critically, making hand hygiene facilities accessible and easy to use.
Technology can help too.
It seems so. The book mentions hand hygiene training apps, some using augmented reality, and electronic monitoring systems in hospitals that track compliance automatically, providing real-time data.
What about reaching kids?
Super important. Starting early. The book highlights the Henry the Hand character and associated educational materials and programs used in schools. Studies look at what works best for teaching different age groups.
And using disgust as a motivator.
Yes, the work of Dr. Valerie Curtis is mentioned. Tapping into our innate feeling of disgust towards contamination can actually be a powerful driver for adopting cleaner habits. A study observed restroom behavior and found certain disgust-triggering messages did increase hand-washing rates.
Fascinating. And what about rules and regulations?
They play a big role. The U.S. Food Code provides guidelines for food handlers. Cities like New York have extensive local health codes covering hygiene.
But regulating can be tricky.
Very tricky. The book discusses challenges, like regulating antibacterial chemicals such as triclosan, which was eventually restricted in consumer soap.